We offer infant CIMT programmes to children from 6 months of age. After initial telephone consultation, we book a child in for a thorough assessment. Our infant CIMT programmes aim to provide early intervention for children with hemiplegia, for example due to cerebral palsy or brain injury. Often children of this age do not have a definitive diagnosis of hemiplegia, or they have had recent diagnosis. Children shouldn't have a hand preference until around the ages of 4 or 5, therefore if a child does have a hand preference at this young age, then it is worthwhile getting that checked out. After an initial phone consultation, we decide whether a child is suitable for an assessment. So we look at a child's suitability. Do they have an arm preference? Do they have a diagnosis? What current level of movement do they have? A child of 6 months old will be reaching and grabbing for items, and if they have a hemiplegia, you may be more aware as their carer that they're not using both sides equally. The effectiveness of early therapeutic intervention is supported by clinical studies. Therefore, our CIMT infant programmes aim to take advantage of this critical and precious time in a child's development.
Good girl.
For our infant programmes, children come to us for 2 hours per day of intensive therapy. For the rest of the day, we aim to enable parents to continue on with therapy to allow a child to reach their maximum potential over the course of their CIMT programme. We work with the child's current stage of development and interests whilst being mindful of a child's overall development and next steps. Sessions are educational for parents, as this is often a family's first time their child has accessed CIMT. Families who have completed our infant CIMT programmes have reported that the improvements a child has gained whilst being with us have continued on after they have left therapy, and these improvements have transferred into their everyday life.